Tonight we're digging into the latest data which shows the town of Onondaga with a sudden surge in coronavirus cases. And by process of elimination, News Channel 9's Andrew Donovan finds the outbreak likely in one particular nursing home.
I bet you if you study some geography, you can figure some things out in these numbers. That's the only hint you get.
I'm taking the county executive's advice using his own maps. A trend I've noticed is in the town of Onondaga. On Friday, there were 40 confirmed cases. Then on Saturday, there were 45 cases. And then a spike on Monday, there were 67 cases of coronavirus. That's a 27 case increase over 4 days, third most of any town in Onondaga County, and the most in terms of percentage of the town's population.
The municipalities that have seen spikes are clearly related because they have buildings related to seniors in their municipalities.
Nobody at the county or state will name the facilities, so we're working around them. The assessor's office lists 4 senior care facilities on the town of Onondaga tax rolls. Managers at 3 of them, Iroquois Nursing Home and the Peregrine and Brookdale retirement communities, tell me each has 0 active cases. That leaves Van Dyne, which informed its 500 residents of people both in the facility and sent to the hospital with coronavirus. Managers there haven't gotten back to me with an exact number of cases, but the state health department reports 90 residents have been tested. This proactive testing is finding people infected who aren't even feeling symptoms and didn't even know they had COVID-19 in a handful of facilities.
It's easier to fight it when it's contained like that, but there's more risk related to that building. That's why we wanted to identify everybody who works and lives in the building.
Focusing on where coronavirus is most dangerous. In Syracuse, Andrew Donovan, News Channel 9.